Good afternoon, friends. Thank you, Raviji, for that introduction. My name is Dr. Karthik. I'm an IS officer from the 2008 batch. I'm presently Secretary Health in government. I also a physician by training from the All India Institute of Medical Sciences. And of course, did my PhD in computer science. I specialize in AI. And so what I will quickly do is I'll present to you some of the global things that are happening around AI and more specifically on health. But what I want to do is essentially when we talk about AI, very often we believe that AI is probably too far away. So let me walk you through what is really happening globally. One major change that has happened in the past 2 weeks is we now have two Nobel Prizes just for one field, and the field of AI. You have a Nobel Prize for physics for the fundamental work in AI, and then for the applications you have a Nobel Prize in chemistry. So that's really remarkable because in human mankind, one field getting two Nobel Prizes has certainly not happened. Now, why is therefore AI so big? Why is the world talking so much about AI? But the fact is, AI has essentially been there for about 65 years. So there's nothing new about AI. But there's something very interesting that's happening right now, and that is therefore extremely illuminating globally. So therefore, there are clearly six broad reasons why we're talking about AI now. The first major reason, as you can see, is the amount of global data that you have is actually doubling every 2 years. But you also see that the computational power that you have to generate AI models is also doubling. But what's also very interesting is that the cost that you will take to build these models, to train these models, is actually reducing by 99%. And apart from that, there's an exponential growth of research in AI globally. And what we're also seeing that there's a huge capital expenditure on AI. For example, if you look into just three big companies, Google, Meta, and Microsoft, just in the year of 2024, they've invested close to 150 billion US dollars. So that is the amount of investment that's happening in AI. But what we're also seeing is where the variety of key changes that are coming in are now converging to kind of give that potential for explosion of AI. But what you'll also see that globally, as these changes happen, AI is now considered that if you have internet, which kind of truly transformed our lives, AI by itself is probably going to have 3 times more power, more impact than even internet. So that's a key thing which is happening globally. So what I want to do is I want to talk about what is happening in healthcare. AI in terms of healthcare is a very difficult sector because digitization efforts are very minimal. There's only just about 5% of data that's available globally for AI. But there is a tremendous potential because you can also see there are a large number of AI research work that is happening globally. And what you'll also observe is that you have a myriad number of use cases. So AI is essentially being used right from prevention, promotion, diagnosis, treatment, and even rehabilitation. So across variety of use cases, whether it is from population health, individual health, you'll actually see that the amount of AI application that are there in healthcare is transcending the entire care path in healthcare. But what is also going to be very interesting is that this is truly happening because the number of large language models, foundational models, like the chat GPT that you hear, are actually increasing in number. So chat GPT came in 2022, and from 22 to 24, there are close to about 40 large foundational models that have come out in the world. So very soon, the world is going to be divided into two sorts of people. People who use AI are going to replace people who don't use AI. So that's the clarion call that we can certainly get. And what we are also seeing in healthcare is a lot of studies now suggest that physicians, when they communicate with the patient, and when a large language model communicates with the patients feel that the chatbots have greater empathy. They're also higher quality of engagement with patients. So slowly people are becoming comfortable with LLMs being used in healthcare. What we also see is that LLMs have become a little more diagnostically more accurate, as well even in treating and diagnosing extremely complex cases like even obsessive compulsive disorders. And it's not only that, the importance of AI in treating radiology is widely established. AI for being used for pathology and for diabetic retinopathy screenings. This is again well established now. There's a lot of science to suggest this. But what we're also seeing is now new ways of using AI. One is we're using AI for drug discovery. So that is fairly new field that is emerging. We're also using AI to forecast what are the types of infections that could happen in an ICU. We're also seeing AI for public response systems. So there is a constant evolution in which AI is being used globally. But what is now one major change that has happened is, earlier when we think about large language models, it is only merely a text to text. You've given a text, it will give you a text response. But now we're thinking about multimodality. So what we're essentially saying is AI not to be used just for a text to text, but also a variety of modalities. And that is how human beings. So when you go to a doctor, you'll actually see a doctor talk to you. So that is a text data. You'll have the doctor do physical examination. So there's structured data that comes in. He'll also give you investigations. He'll also have imaging. So a variety of multimodal data the physician takes in and makes a diagnosis. Now you'll have a large number of LLMs which can have this potential to use multimodality as well. So what we're seeing now is that once you use multimodality, your AI can actually truly mimic human thinking and human reasoning. And that is something which is extremely exciting. But it is not that Gen AI or large language models don't have challenges. We do recognize the challenges of large language models. For example, these large language models, when you ask them a question, they hallucinate. For example, they'll be so overconfident in giving an answer, they confabulate, they hallucinate, and very often they're not correct. But yet they're overconfident, and we now know how to solve this problem as well. So you will hear something called RAGs, the retrieval augmented methods. So essentially, we are growing very fast in AI globally. But how is it in terms of hospitals? Are hospitals really ready to adopt this AI? Now, let's take the example from the United States, because that's where I did do most of my research. What is very interesting is even extremely big hospitals in the US, if you look into Stanford is staggering at about 16. So Stanford is by far the bed of all the AI research, but the Stanford hospital by itself is still not ready to adopt. So if the US hospitals are like that, one can assume where the Indian hospitals would be, right? Now, globally, what is happening therefore in healthcare, one recognizes that the private sector is moving at a much faster pace, and therefore government needs to really catch up. And often the government is really not aware of some of the key changes that are happening. So what we're now trying to think about is globally we see that the United States, through an executive order, has essentially passed a regulation of AI, and the EU is the first continent, the first region in the world which has passed a law on regulating AI, primarily because AI is going to be right on your face right now. Now, what we also recognize is globally, the United Nations has now passed a new resolution called Governing AI for Humanity. So as AI comes into our lives, we need to really govern it, because AI can have a large number of problems as well, both in terms of its harm, both in terms of its safety. So regulating AI is, of course, the need of the hour. But what we want to think about is, what is AI going to look like in the future? What are some very exciting changes that are happening globally in AI? Now, if you look into it, traditionally we've used AI just to solve basic problems. But what is going to truly make a remarkable difference is this concept of humanoids or robots. So what is going to happen is, around the world, for example, when Vinod Khosla, who is the head of the Sun system, essentially says, why should a large number of mundane activities be done by human beings? So therefore, there's this robotics and AI which have emerged as one big change. So therefore, you'll actually see that a large number of big firms are investing millions and millions of dollars on building these humanoids. Now, these are not very far off. It is not that we are in a fantasy world. These are coming right at us. Now, let's just see Optimus, which is a Gen 2 one, which is essentially been built by Elon Musk. And this is from March 24. And by October, the ability that the humanoid has itself undergone a tremendous change. So you can actually see that the humanoid has ability to do a variety of dexterous activities. It is not that it is only doing very big, large skills, but it can also do very, very minute skills. So essentially, a large number of labor skills that we use human beings for, essentially the humanoids can actually perform those activities. So what is going to be very interesting is it's not just one company that is investing resources. There are a large number of companies which are investing resources on humanoids. So I want to quickly show you what a modern kitchen essentially could look like. You could essentially have a humanoid do a large number of activities which are extremely very fine skills. You want to touch and perform them, the humanoids would potentially be able to do that. So what I'm trying to essentially also want another major change that we are seeing globally is now there are going to be autonomous vehicles that are not run by human beings but by AI. So this is essentially where the next major revolution is happening. So you have now in the US what's called turbo taxis. These are taxis that are essentially having an ability to have a scan, which is a 360-degree scan. So it is like a human being. When a human being drives, you have an ability to look into a 360-degree view. And that is what is called a world model. So globally, what we're seeing now is it is not that these autonomous vehicles are going to be a thing of the past or thing of the future. They are today, they're right now, they're coming in a big way. And primarily because now what is going to happen is, as you can see on the bottommost one, as this autonomous vehicle moves in, it is able to scan and build a heat map of all the major inanimate and animate objects. So it is able to give you a good scan of the world model. So it's almost like a human being, and it's able to use all of this data, and is likely to be very accurate. So essentially what we are seeing, therefore, is we are now moving towards a new way of doing work. So we walked through the system of what is called a belt and line shaft system, which is in the past. Then we moved into this century of the 20th century was essentially on assembly line. Now we're moving to a new system where we're essentially saying, why should human beings walk to shelves? These big shelves can come to human beings. So in Amazon, for example, if you ask 20 items from Amazon, in a fulfillment center, instead of the individual going to all the 20 shelves, the individual stands there, but the shelves will move towards individual. So your Amazon fulfillment gets much quicker. So today, if Amazon is able to perform your fulfillment fairly quickly, this is because, again, of AI. Now, this is going to be truly transformational. Think about a hospital where you need to go to different departments. Imagine the department's shelves can actually walk to you. And that is the potential with AI. So these are big things that are happening. But what we're now seeing is, because most of these data centers, AI is essentially going to thrive on power and electricity. So what you're now seeing is big companies in the US are essentially buying nuclear power plants. So if you heard of the 3 Mile Island nuclear plant, which was actually shut down because there was a nuclear implosion, now Microsoft has essentially purchased the entire nuclear power plant, primarily because there's a huge need. So there is competition that is emerging between the big tech firms to buy electricity and to procure renewable forms of energy. So therefore, what I'm essentially trying to say is there are newer changes that are happening in AI. Now, today, AI, your large language models, also have ability to not only do text to text, but they're also able to generate videos. So it is not going to be very far off when you'll have a complete movie generated by AI. So just to give you an example, there are 3 companies in the US. Each of them have invested over in close to about 50 to 160 million US dollars, just only for one thing, to convert text into videos. And I'm just giving you, these are 3 small startups. But if you look into companies like OpenAI or Meta, they've come up with new models which are able to generate highly complex text to video generation. So globally, what we're seeing is AI is able to make this tremendous changes all in a matter of about the last 2 years. And the next years that are going to come in, AI is going to be a very big change, not just in the US or in China, but also in India. Now, what I want to just highlight here is that globally, as AI goes, as AI is going to churn in this information, one key skill that we will all need is an ability to ask good questions. Because essentially, when you use a large language model, it will do well when you ask it a good question. So the only thing that I will urge you all to think through is, as you go home, as you walk away from this session, is the world is at a ripe time where it's going to categorically divide people into people who use AI are going to certainly replace people who will not be using AI in the next 5 years. So therefore, if you want to truly use AI, All that you need to learn is asking good questions, and your AI models can certainly perform them. So thank you all so much for your attention.